the study is called Clinical Utility of Biologic Signature to Assess DCIS Recurrence Risk in Patients Meeting Good Risk Criteria, Interim Analysis of the Decision-RT Predict study. And the purpose of this study was to compare traditional clinical and pathologic features that we use from a patient's history and physical, as well as their pathology report, in trying to decide who cannot require radiation therapy after breast conserving surgery, and compare that to a biosignature test, which is patient-specific driven and is called Decision-RT. And this was based on a registry study that was performed and is still underway. And from the first 513 patients enrolled, this is what this analysis was from. So the most common questions that I get asked about this study is, first of all, how does this study and the test that was used in this study impact treatment decisions? And I think it's important when we look at the results of this study is that while the goal of this study was to look to see how we can avoid overtreatment, we also want to look to avoid undertreatment, meaning patients who may have higher risk disease than we initially thought. And what the key results of this study show is that by using this test, not only did we potentially reduce overtreatment by reducing the number of people recommended to receive radiation after testing, but we also, in some subsets of patients, actually increased the recommendation for radiation therapy when they had not been recommended to receive it prior to the Decision-RT testing. I think this data will absolutely impact clinicians, as it will help them move beyond traditional clinical and pathologic features and really move radiation decision-making for women with DCIS into the modern world. We have, in many other areas, used tumor genetics and biologic signatures to help identify